Welcome to Paragon CRT, a new non-invasive reversible system for achieving vision correction through contact lens overnight corneal reshaping. When worn during sleeping hours, Paragon CRT lenses gently and temporarily reshape the cornea without permanently altering its physiology. As an addition to LASIK or other treatments, Paragon CRT offers you a chance to treat and retain more of your patients. In fact, patients presented with a choice prefer Paragon CRT to all other treatment modalities. And Paragon's marketing and professional services will allow you and your patients to take full advantage of the benefits of CRT. CRT is safe and effective, as shown by extensive clinical trials. A streamlined dispensing system allows you to fit up to 80% of your patients immediately after the initial exam. The dispensing system consists of a 100-lens set, peripheral support tools including topography-based patient management software, and ongoing support from Paragon Vision Sciences and Paragon CRT authorized laboratories. Before you can prescribe Paragon CRT, you must be certified. This presentation will help prepare you for certification. A brief review of corneal structure reveals 5 layers. Current data suggest that most of the therapeutic action of Paragon CRT takes place in the epithelial tissue. The concept is simple. Paragon CRT redistributes and compresses epithelial tissue, decreasing thickness in the center of the cornea while increasing it toward the periphery. This change redistributes the refractive power of the cornea to achieve the desired vision correction. To accomplish this, a specially designed lens puts pressure on the tear layer, promoting migration and compression of epithelial cells. If treatment is discontinued, the process is reversed. The Paragon CRT lens is divided into different zones, each corresponding to the function it performs: the treatment zone, the return zone, and the landing zone. The distance from edge to edge is called the OAD, or overall diameter. Ideal OAD is approximately 90% of horizontal visible iris diameter, HVID. Lenses in the dispensing system are 10.5 millimeters in diameter. At the center of the lens is the treatment zone. In the Paragon system, the treatment zone diameter is defined as 6 millimeters. The back surface curvature of the treatment zone is the base curve. As treatment progresses, the cornea conforms to the shape of the base curve, achieving the desired unaided vision correction. Moving outwards, the return zone and the landing zone provide centration and proper alignment of the lens. Together, they control how the treatment is applied. The return zone is 1 millimeter wide. It consists of a sigmoid curve that returns the lens design to the cornea. The return zone depth, or RZD, is a crucial factor in the Paragon CRT system. Lenses of varying RZDs are available to allow precise control, centering and positioning the lens to deliver the treatment to the eye. During fluorescein evaluation, a lens with the correct RZD should center on the cornea and show at least 4 millimeters of applanation in the treatment zone. 4 to 5 millimeters of applanation is acceptable. A lens that is too deep will likely show little or no applanation in the treatment zone. If this is the case, you will need to try a lower RZD. A lens that is too shallow is unlikely to center well. If this happens, you will need to try a higher RZD. The goal in fitting RZD is to find the shallowest lens that centers and provides at least 4 millimeters of central applanation. The landing zone allows the lens to settle safely on the mid-periphery of the cornea, and it assists centration while minimizing lens impingement throughout treatment. The correct landing zone angle, or LZA, provides tangential touch in the center of the landing zone. Lenses of varying LZAs are available. The LZA is measured from horizontal. Different landing zone angles affect the edge lift. Lesser angle, more lift. Greater angle, less lift. During an exam, it is easiest to evaluate the landing zone angle by observing this edge lift. Lenses with appropriate LZA will show a narrow band of fluorescein at the lens edge. This will provide a soft, centered, and safe landing. A lens with excessive edge lift will land inwardly toward the return zone. This is indicated by a wide band of fluorescein at the lens edge. If this is the case, you will need to try a greater landing zone angle. A lens with insufficient edge lift will land too far outwardly toward the periphery. There will be almost a complete absence of fluorescein at the lens edge. In such cases, you will need to try a lesser landing zone angle. The goal in fitting LZA is to find the lens that provides a tangential landing zone with appropriate edge lift in the majority of the circumferential edge appearance. All these parameters, overall diameter, base curve, RZD, and LZA, affect the sagittal depth of the lens. Since the selected base curve remains fixed in the Paragon system, the sagittal depth is adjusted primarily by selecting the correct RZD to accommodate the patient's corneal curvature. LZA has some effect as well, but is used primarily to control the location of the tangential landing in the periphery. There are 4 objectives to fitting the Paragon CRT lenses. The first is to provide a base curve that will reshape the cornea to produce emmetropia or low hyperopia. The second objective is to provide precise control of the treatment. That is, to make sure the base curve is positioned correctly to reshape the cornea. Return zone depth, RZD, primarily provides this control. The third objective is to provide a landing zone that is tangential to the cornea in the mid-periphery. Landing zone angle, LZA, accomplishes this. The final objective is to provide proper centration. RZD, LZA, and lens diameter all affect centration. After the initial fitting, the correct lens will have a fluorescein pattern that shows at least 4 millimeters of central bearing, transitioning to clearance in the return zone. In the landing zone, the lens will demonstrate peripheral tangency and a paracentral edge lift. After a period of treatment, the lens will have settled, reshaping the cornea. The lens will continue to center and exhibit good edge lift. It will also show an increased applanation area in the treatment zone. Utilizing 2 pieces of routine clinical information, the manifest refraction sphere, or MRS, and the flat keratometric readings, a straightforward slide rule guides you to the suggested initial lens for any given base curve. The 100 lens dispensing set is divided into 12 base curve groups. You will only have a few decisions to make after selecting the initial lens. All the lenses in the dispensing set are 10.5 millimeters OAD, selected to fit most patients. Once you apply the initial lens, immediately evaluate lens fit using fluorescein. A Ratten filter is recommended to enhance observation. There are 2 parameters that may require adjustment: return zone depth, RZD, and landing zone angle, LZA. A decision matrix will guide you through the fitting process. Evaluate centration to select the correct RZD. Rows on the matrix represent RZD from deeper to shallower. The initial lens you fit is the center of the decision grid. If the lens does not center, we recommend you apply a deeper lens, that is, a higher RZD. If the initial lens centers, you may need to apply a shallower lens, a lower RZD, until you have found the shallowest lens that centers and provides at least 4 millimeters central applanation. Evaluate edge lift to select the correct LZA. Columns on the matrix represent LZA from lesser to greater. A simple decision lets you choose the LZA: insufficient, appropriate, or excessive edge lift. Once the initial lens is in place, check for centration. If the lens centers, demonstrates at least a 4 mm central applanation, and has appropriate edge lift, congratulations, you may be finished. But you may still want to try a lower RZD. The goal is to fit the shallowest lens that centers and has at least 4 mm of central applanation. If this next shallowest lens centers and has at least 4 mm of central applanation, it is the correct RZD. Move on to edge lift evaluation. If this next shallowest lens does not center, it's too shallow. Return to the initial lens and evaluate edge lift. The correct lens will center and provide at least 4 mm of applanation within the treatment zone. 4 to 5 mm of applanation is acceptable. If the initial lens you fit does not center, it is too shallow. You will want to try a higher RZD. If this next deeper lens centers, move on to evaluate the edge lift. On the other hand, if this next deeper lens does not center, try a lens with a greater landing zone angle. If the lens with this increased angle centers, dispense it to your patient. If it still does not center, your patient will need a custom lens. Once the RZD is determined, move on to evaluate edge lift. Edge lift evaluation requires only observation. Appropriate edge lift will provide a soft, centered, and safe landing, and will show a narrow band of fluorescein at the lens edge. If the lens provides appropriate edge lift, dispense it. Insufficient edge lift will land near or at the periphery of the lens. There will be almost a complete absence of fluorescein at the lens edge. Try the lens with the next lesser LZA. Excessive edge lift will land inwardly toward the return zone. There will be an excessive amount of fluorescein at the lens edge. Try the lens with the next greater LZA. If you cannot fit a lens from the 100 lens set, you will have to order a lens with the desired parameters. Talk to your authorized Paragon CRT laboratory consultant or contact Paragon Vision Sciences directly. However, if you follow the fitting procedure carefully, up to 80% of your patients should have satisfactory results after the initial fitting. Let's review the features of a properly fitted lens. Good centration, with at least 4 mm applanation in the treatment zone, and a tangential landing zone with appropriate edge lift. An important consideration is that you must manage patient expectations. Completed treatment takes up to 2 weeks of consistent overnight wear and is dependent on patient-to-patient variability. Although patients will always be able to see clearly with their Paragon CRT lenses on, the use of temporary soft lenses or eyeglasses may be preferred during this time period. And even after the initial treatment is complete, ongoing overnight treatment with Paragon CRT is required to maintain target vision. Patients who understand these facts are most likely to be satisfied. Conduct a follow-up exam the morning after dispensing Paragon CRT lenses. Check visual acuity with lenses on, and conduct an over-refraction. With lenses on, refraction should be within 0.5 diopters of plano. Check fit using fluorescein. Remove the lenses, refract, and check visual acuity. If available, use topography to evaluate the position of the treatment zone and corneal surface changes. During periodic follow-ups, conduct a thorough slit lamp exam with fluorescein. If there's a problem with the fit, observe and evaluate centration and lens movement. Check degree of applanation in the treatment zone. Evaluate edge lift. Finally, conduct an over-refraction. The result should still be within 0.5 diopters of plano. As with any treatment, you may encounter occasional difficulties. These are covered in a detailed technical troubleshooting guide. You can also contact your authorized Paragon CRT laboratory or Paragon Vision Sciences for assistance. Finally, contraindications are similar to those associated with any contact lens. Any one of these is enough to preclude the use of Paragon CRT. See additional details in the fitting guide and package inserts. You will need to pass a certification test before you can prescribe Paragon CRT, but understanding the material in this presentation will help prepare you for that goal. Contact Paragon for details. So congratulations and welcome. Paragon CRT is a way to ensure your practice will thrive while giving your patients more options. In short, Paragon CRT will reshape your practice.